So, all right, well, we'll go ahead and get ourselves kicked off. I want to thank everyone for joining us today. The session today is being recorded and it will be available after the event on Amplio's website. And I believe we will also send it out to you all as a link for those who registered. My name is Bea Covington. I am the Global Partnerships Director at Amplio, and I'm going to be facilitating our conversation. With me today, I have Abanet, who is currently serving as an adolescent health and gender advisor for CARE Ethiopia's Act With Her project. And the Act With Her project is an initiative to empower adolescent girls in the Oromia and Afar regions through sexual and reproductive health and rights education and life skills. And we're going to be talking in depth a little bit about this project after we do some introductory sharing about the talking book and some of its particular features. Before joining CARE, Abanet was the assistant to the head of mission for Médecins Sans Frontières at PSI Ethiopia. She served as the clinical network services coordinator for a USAID-funded HIV/AIDS project. She has a master's in public health from Mekelle University and a nursing degree from Jimma University. So thank you, Abanet, for joining us today. We also have Mekdes.
Hello.
Oh, yay, the microphone works.
Hello.
Okay, yes, we got you. Good. So we have Mekdes. Got it. Yeah. So we also have from CARE, we have Mekdes. She is the Learning Design and Measurement Manager for CARE Ethiopia. And she has worked as a monitoring and evaluation and learning specialist since 2009. And prior to joining CARE, she worked as a monitoring and evaluation specialist for Addis Ababa University for Health Limited, for Ethiopian Society of Obstetrics and Gynecologists, and the Addis Ababa City Administration Health Bureau. She has an MPH in biostatistics and epidemiology from the Université Libre de Bruxelles and a master's degree in monitoring and evaluation from Jimma University. We also have on our panel today Lisa Zook. She is Amplio's monitoring, evaluation, and learning advisor. She also is the director of research and impact at InformEd International. She has over 10 years of experience working with international development programs in health, WASH, education, and livelihood sectors. For Amplio, Lisa supports the research and development of products and services, focusing on effective data visualization and communication to inform program decisions. She's the co-founder of the Seattle Evaluation Association, and she has worked with CARE, Save the Children, World Vision, UNICEF, World Bank, and Right to Play, among others. She also has a master's in public health and epidemiology and global health from the University of Michigan and a mathematics degree from Davidson College. So thank you to our panelists for agreeing to join us today to talk a little bit about participatory monitoring and evaluation and your experience with the talking book. So the format for our conversation today, I'm going to spend a little bit of time talking about some background and history around participatory monitoring and evaluation, very brief, because I suspect everyone in our audience knows a lot already. And then I'm going to turn it over to Lisa, and she's going to talk a little bit about the talking book and how it specifically can enable and enhance participatory monitoring and evaluation activities. And then we will turn to a dialogue with Mekdes and Abanet to talk specifically about the work that they have done with the Act With Her project in Ethiopia. So without further ado, next slide for me, please, Lisa. So what is participatory monitoring and evaluation? I think this is a term that many of us are familiar with and have heard and experienced for many years now. We started talking about participatory engagement back in the late 70s and early 80s, and it's only natural that as we start to talk about engaging stakeholders and communities in co-creation of programs and projects, that we would naturally also start to talk about engaging them in the monitoring and evaluation component of the project cycle. So next slide. These are some definitions, and I'm going to be frank with you. The next couple of slides there's nothing original in any of them. They are all pulled from, all the information is pulled from a series of sources that I will we will give you at the end. But as you can see, these different definitions come from UNICEF and from a large survey literature review that was done by the Institute for Development Studies. And so I think the words that stand out when you look at these definitions are words like partnership and collaboration involving stakeholders. It can cover lots of different types of participation, looking at that second definition. Looking at the third one, this one is pretty general, but they all are focused on this idea of partnership and collaboration. So let's go to the next slide. There are lots of ways that we can use participatory monitoring and evaluation. It can be used for impact assessment, for project management. It can also be used as a tool for organizational strengthening and organizational learning. And if you look at the material that is out in the open source domain from Equal Access in particular, and we've included a link to that at the end of our presentation, they focus a lot on using the participatory processes to serve as a tool for organizational learning and strengthening organizational capacity. You can also use a participatory monitoring and evaluation approach to understand and negotiate stakeholder perspectives. One of the things that you see a lot of in the literature around participatory tools in general and monitoring and evaluation in particular has to do with considering power dynamics and access dynamics when you're thinking about who are the stakeholders who have a voice at your table. And so there's a collection of literature around that piece and those dynamics and how you can not only use participatory monitoring and evaluation to enhance the likelihood that all of the stakeholders and the voices will be at your table, but also articles cautioning that you are mindful of that. And then lastly, providing accountability. And I think the first one and the last one are typically reasons why we think we do monitoring and evaluation, because our funder wants to know what's going on. But there are all these other ways that monitoring and evaluation and participatory monitoring and evaluation can be used through the project lifecycle. So next slide. Okay, so again, looking at those earlier definitions, the hallmarks of a participatory approach are this idea of participation and of learning and mutual learning and co-creation, the idea of negotiation between the evaluator and the evaluatee, and also flexibility, because if you are using a participatory process, you are likely going to find that your outcomes or your areas of focus or even the indicators that you choose may be different from what you thought they were going to be when you started out your process. So the next slide. So here's I love this little comparison, and this comes from the lit review that the Institute for Development Studies did. And they talk about the fact that conventional monitoring and evaluation usually is done by external experts, to or on a receiving population. The indicators are predetermined and they're usually set by that external expert. And there is this focus, real or imagined, on science and objectivity. And then these are usually done at the end or the midpoint of a project. And their primary reason is accountability usually to the donor. In a participatory process for monitoring and evaluation, just like any participatory work that we do, the community members and the beneficiaries are typically the folks who actually create and manage and implement the monitoring and evaluation activity. The indicators are typically identified by the people, by community members and beneficiaries, and they may or may not be what I call count indicators. Often in a conventional monitoring and evaluation scenario, we focus on dollars spent households reached, things that we can count. In a participatory environment, you may be able to pick up on things that are softer and less tangible. Participatory evaluation is open. It often happens throughout the life cycle of a project. It is usually based on cultural norms, and the focus really is on sharing and learning and growing. And then at the end of a participatory process, the desired outcome, you certainly want accountability, and you certainly want to understand and improve your project, but empowerment and ownership is really the ultimate outcome of a participatory monitoring and evaluation process. So I believe the next slide is going to be handing over to Lisa, who is going to talk to us about the talking book. But before I do that, for those of you who are not familiar with the talking book itself, very quickly, it is a handheld, battery-operated device that functions without the need for internet connectivity or utilization of cell phone minutes or anything like that. And you can program message content, audio content on this device in any local language, and you can put any kind of content on the device. We're going to be talking about sexual and reproductive health and gender and women's issues in the context of this discussion, but the talking book has been used across a range of situations, working with agricultural extension agents, working with WASH projects, working with information around land rights and land access. So if you can speak it, you can put it on a talking book. And in addition to being able to put messages onto the talking book that people can listen to, either in individuals settings or in group models or in a household, the talking book is always collecting data on the messages that are being listened to. And that data is available to the program to understand what's being heard and how often it's being heard. And then what we're going to talk in detail about, and I'm going to turn it over to Lisa Zook to do this, is the user feedback feature. So when a community or an individual is listening to the talking book or to the message on the talking book, there is the capability for them to record their thoughts and their reactions. And you can either do that through a series of prompts that you embed in your messages, or you can just have that happen organically as the talking book is moving through your communities. Before I turn it over to Lisa, I want to encourage people to put your questions in the chat. We will have time at the end for dialogue with our panelists, and so we'll be pulling questions from the chat, and Erin will take those and bring them back to us at that point in the program. So without further ado, I'm going to stop talking and I'm going to turn it over to Lisa and let her tell you a little bit more about the capabilities of the talking book. So Lisa, over to you. Oh, Lisa says, Erin, you need to unmute her. There we go. You should be ready to go.
Great. Can you hear me?
Yes. Yes, we can hear you. Now we can't.
Okay. Hopefully I can stay unmuted here. Hi everyone, I'm Lisa. I'm the Monitoring Evaluation Learning Advisor here at Amplio, as B introduced. I just wanted to kind of talk about the talking book user feedback feature. And I'll say that personally, as a monitoring and evaluation specialist, this idea of participatory M&E is something that I think about all the time, and how I can better make monitoring and evaluation activities participatory. And so when I joined Amplio, I was really excited about this feature because I do see a lot of really good ways that it can empower the communities in which we're working, elevate their voices, bring their voices to the table for decision making. So the user feedback feature is really just the ability to record audio messages on the talking book. So there's a small microphone on the talking book, and users can record their reflections. Those audio files are stored on the talking book, and then when that talking book is plugged back in, those recordings are made available to the program team. When we talk about how those user feedback messages are gathered in the field, you'll see this photo here. This is a community health worker in Samburu, Kenya, and she's been facilitating a mother's group, talking to them. They were reading stories, acting out a few different scenarios, and then they were listening to the talking book. And she would then ask some questions to those mothers in the group and record their feedback using the talking book. So here she's leaning over to record one woman's reflections there. So that kind of falls into this category of prompted user feedback. So that facilitator was asking people specific questions, their thoughts, their reactions to messages that they were listening to on the talking book. That can also happen within the recordings themselves. So if someone is listening to the talking book by themselves, at the end of a message, there can be a question posed to them, encouraging them to leave their reflections on the message through the user feedback feature. And then there's another category of user feedback, which is unprompted user feedback, which is just due to the fact that the talking book can gather these recordings at any point when someone's listening. They can press the button to leave a message, anything that they're feeling, thinking, reflecting on during their time interacting with the talking book. So we've seen it applied in a lot of different ways across our partners, whether it's individuals that are listening to the talking book and recording their messages themselves, this facilitated method that you see here on this slide, and then also in group sessions. So all of those recordings get uploaded to the server, and there's thousands and thousands of audio recordings from community members that are listening to the talking book. And then we're faced with this daunting task, especially those of you involved in monitoring and evaluation. You're thinking, wow, that's a lot of qualitative information, which is great. It's phenomenal. It's such a great data source, but how do we make sense of that? And that's really where we've been spending a lot of our time over the last few years, is thinking through how do we really process this information so that it's actionable and digestible for the team. So we've developed this new processing application here that you'll see. This is a snapshot of a web page, and you would go to this web page to access the user feedback messages. You can press play here and listen to a message that was left in the community. And you can see the numbers of the messages up above there. Below that, we've been working to develop kind of a processing tool, which you can think of as a survey, and that helps the listener essentially make sense of all the messages. So it takes this really vast qualitative data set and turns it into some simple questions that really help you make sense of all those messages and present it in a more quantitative way. From that processing, then the results are presented on our dashboard, again with this goal of really helping the team facilitate decision making, better understand what's coming out of the user feedback messages. So that's my overview of user feedback. I'll turn it back over to you, B, so that we can discuss specific applications.
Great, thanks Lisa for that overview. And the basic dashboard is something that all of our partners have access to as part of their contract to own and manage the talking books. And we do provide training for everyone in how to use and access that dashboard and all of the software that's required to run the talking book. But now that we know a little bit about the talking book and its monitoring and evaluation capabilities, I'd like to engage with our partners from Ethiopia. And I had a first question for Abinette, but it looks like she may have dropped off. So Mekdes, I will give it to you perhaps. And that question really is to tell us a little bit more about the Act With Her project. Who was the target audience? What was the issue or the issues that you were trying to address or you are trying to address? And oh, I see Abinette has come back. Excellent. And then, why did you choose the talking book as a tool for engaging these communities? So I will turn it over to you, Abinette. And Aaron, I think you're going to have to unmute.
The panelists should be able to unmute themselves.
Okay.
Hello, can you hear me?
Yes.
Okay. Thank you. To start with a highlight of Act With Her project, let me start with introducing what and how Act With Her project works. Act With Her project is funded by Bill and Melinda Gates Foundation and implemented by Pathfinder International and CARE USA. And it aims to empower adolescent girls and to improve the gender equality and empower adolescents age 10 to 19. And we worked in Ethiopia in 4 regions, previously as in 3 regions in Amhara, Oromia, and Afar. Afar is where we implemented Amplio Talking Book, and currently we are incorporating Southern Nation and Nationality and People region as a further regional state. And this project is a research project, and I don't know whether you know it or not, there is a GAGE consortium which does research on adolescent and gender especially. It is a Gender and Adolescent Global Evidence, or GAGE, and it is funded by DFID, Development for International Department for International Development. And according to this organization, the topics we prepare for all adolescent girls curriculum are based on health, especially sexual reproductive health and nutrition and safety or body integrity, education, girls' aspiration and setting goals for their life, and improving their communication skills. So GAGE gave us 6 domains where we can shape our curriculum, and all the Act With Her projects in the country uses the similar curriculum, that is a paper-based curriculum. And so for the Afar projects for adolescent girls 10 to 14 years, when I say adolescents, for adolescent boys and adolescent girls 10 to 14, we prepared a paper-based curriculum that will be facilitated by near age peer groups, adolescents or users older than our target groups will facilitate the session. And in our projects, we prepare curriculum for 4 groups: adolescent boys, adolescent girls, parent, and social analysis and action groups, or the people or the power holders who discuss on the gender-related issues that affect adolescent girls and well-being. So out of the 4 curriculum, we implemented all that curriculum in the 4 region. In Afar region, where we implemented Amplio, we faced problem of facilitating this paper-based curriculum because I don't know whether you know it or not, Afar region is a pastoralist region, and most of the time they have the people or the community was moving for looking for feeding for their cattle or sheep or goats and camel. So they will move from one place and to another. And to give this curriculum-based session, it challenged us in between the implementation of the project. So we came across about Amplio Talking Book technology. And so we shifted our attention of using paper-based curriculum to technology-based information dissemination. So we contacted Amplio Talking Book because our community are hard to reach. The pastoralist is just to describe for you, this group of people or this region is mostly depend on their herds, especially camel and goats. They move from one area to another. They cross many rivers, and if it's rainy season in the adjacent region, there will be flood. And it is very difficult for our mentors to follow the adolescents and give a training or give a discussion, and to provide necessary support to the community. So we designed to change the paper-based curriculum to audio session. So we already have the paper-based curriculum for adolescent boys and girls. So we trimmed that and we recorded in Afar language audios for both boys and girls audio session. And we uploaded it into Amplio Talking Book so that they can listen wherever they go, and at any time that is favorable for the community groups. And we train our resource person or female and boys, female and men living in that locality, or those moving from place to place with our community members or our beneficiaries. We gave them instruction and orientation how to handle the talking book, because it is mostly used for, the talking books is designed as it can be used for illiterate. Any person can follow the instruction uploaded on the talking book and can listen to the audio. So we uploaded it, we give them orientation and give them the talking book device so that they can listen to the audio, and whenever they have questions to upload. And actually we gave them for content that we want to capture qualitatively, because the talking book can access the statistical data. We want to know the other feedbacks, especially on the number of attendants and who attended the session. So we gave them all the instruction on how to handle it and how to open and record the feedback so that they can give us any feedback they have on the program or any question they have on the content. And that's how we used it. And that is how we contact Amplio Talking Book team to support us on using the Amplio Talking Book. Thank you.
Great, thank you for that overview, Avinet. Mekdes, can you tell us a little bit, were there specific reporting requirements for the project? And I know Avinet talked about putting some prompts in the messages to get people to reflect, and she also talked about attendance and things like that briefly, but can you tell us a little bit more about some of those specific reporting requirements that the project had, and how you thought the user feedback function was the right tool for meeting those requirements?
Okay, thank you. Hello, everybody. I am Mekdes Hilma, working as Learning and Design Manager for CARE Ethiopia SRH unit. Coming to the specific requirement for Activism projects, the project title is Activism projects. In Activism project, as earlier mentioned by Avinet, we need different reporting requirements because the project designs to address adolescents and surroundings like norm influencers, boy and men engagement, etc. Like, however, for Amplio utilization for talking book, we are concerned only for adolescents engagement. Here what we went in as a monitoring and evaluations, we went to how many groups established, how many members are enrolled on the talking book group discussions, how many of the groups are active, how many numbers of attendees in each sessions, because we developed 40 sessions for adolescent girls and 90 sessions for adolescent boys. We are expected how many adolescents are attended in each sessions, and we need disaggregated data by gender and the type of attendees. Like sometimes because of the talking book device, adults also attended the sessions. We need this kind of reporting or data items. In addition, as a gender project, we want to trace or to take concerns of adolescents, like any personal issue like violence, forced marriage, school dropout, etc. So we want to record these kind of things in feedback user button functions. These are the project requirements related to data. Coming to the Amplio device user feedback function, we are able to collect data for the attendees, disaggregated by sex and type of attendees like adult or adolescents. We also get some questions, concern, or appreciation from the feedback button data. Thank you.
Thanks for that overview, Mekdes. That's a lot of information that you wanted to collect and keep track of. Lisa, can you tell us a little bit about the process that you went through with Mekdes and Avinet to create the tools and the templates that they would need to achieve these objectives that they had for the project?
Sure, yeah. So we, the survey that we had up on the screen earlier that was used to kind of process the user feedback messages, we have a base example template for that we've developed over our years of experience working with partners and kind of processing user feedback messages and gathering, you know, what types of things most people say or reflect on. And so that was our starting point, but then to that kind of template, Mekdes and her team brought kind of their monitoring and evaluation plan and objectives to that and said, okay, you know, given the way we're using the talking book, and in particular our real need to capture attendance data, we want to build out and adapt that survey to ask those specific questions. So we did an initial kind of rework of that survey, tried that with a few user feedback messages, noticed a few things that we weren't capturing perfectly in that survey tool, did another version of the survey tool, and then went through the whole message processing system, going through all the messages that were created from their user feedback. So I will say that it's this balancing act between, qualitative data that you traditionally explore, identify trends, and it's kind of this process, this exploratory process to get there. Given the vast amount of user feedback messages that we had to balance the desire to do that with developing a survey tool that reflected their M&E plan and objectives.
Great, thank you. So Mexis, maybe I'll direct this question to you, but Abinette, feel free to jump in. As you went through the process of gathering all of the sending the talking books out into the field and having the communities engage with the messages on the talking books, and then getting this user feedback back, what worked and what didn't work? What was challenging for you about using the talking book in this way? And yeah, so we'll start with that. So what worked and what didn't work, and what was challenging for you, or what was particularly successful about it?
Okay, thank you. I said we are successful for addressing the adolescent girls in most pastoralist area or very hard to reach area. So we are successful to reach these adolescents using the Amplio device or talking book. What we worked from M&E perspective, we can capture some important data for the projects, like attendance, type of participants, the session covered, whether the session covered or not, etc., and some qualitative data like appreciation of the sessions and understanding of the sessions. What didn't work for me, because as said earlier, we are introducing this Amplio device for very hard to reach area with very low literacy level, even in a place where there is no schools, health center, etc. So they are far from the modern society. We are lack getting consistent data regarding to adolescent from session to sessions or from group to group. This is one of the challenges to get. The others one are to use the user feedback, especially at initial phase of the talking group discussions. These are the major challenges we faced while introducing the talking group or the Amplio device for the group. We are trying to solve the challenges using the holding review meetings quarterly, because they are inaccessible area, they live in accessible area. We are trying to call the audio resource person centrally, and we are trying to collect data to discuss with them what is the challenge, what is their achievement, etc., and providing support during the review meeting. This is one of the major things we are trying to solve the problems. Thank you.
Great. I'm curious. You all got a lot of feedback, a lot of recordings, right? How was that process of sorting through all of those messages?
Okay, we are trying to sort the messages in collaboration with the Amplio teams. We internally discussed with the Amplio team and try to develop a survey template to capture the important data items for the projects. Based on the templates, we are assigning one of our project team who speak and hear the local language, because Amplio devices are working in different language, like for us we are using the local language, so we are identifying and assigning a project team to listen the record and to transcribe and feed on the survey templates. And then using the dashboard, we can analyze and extract data. And then finally, we are trying to develop reports, both quantitative and qualitative, from the user feedback. Thank you, Lisa. May I add something on it?
Yes. It looks like Avinet, you have your hand raised.
Yeah.
You wanted to say something? Yes.
Yeah, to add on some of the points Magdas discussed. As I at the start, I tried to mention it. Our project is use a curriculum. In the curriculum, it is more of interactive because the mentors and the girls group or the boys group will interact with each other, and they can raise their question immediately whenever they have question. So in this situation, it might be a little bit difficult to use an talking book. When we decide using talking book, we mostly focused on using talking book at least to reach adolescents wherever they go, even to give them information, not to make the session interactive. That is what we thought. Giving them information is enough in this situation. And maybe if they get opportunity and move to the other location, they can have a basic line information so that they can depend on the information they got from the talking book for their future life and for future well-being. So that was worked for us because some of the adolescent girls and boys who are moving with their parents from place to place were able to listen to the audio session. Even though we can't say that it is satisfactory, at least we tried something, and we tried something to convey. And when I come to the user feedback, the most interesting one is you get first-hand information or their feedback directly, and there is no one who can manipulate the finding. That was very nice for me. They are the ones who record whatever they want to convey to us. That was a good one, and we are able to get attendance number and the other issues, and the response on the endorsement of the project or endorsement of the program. And while we are implementing the Amplio Talking Book or distributing the Amplio Talking Book to the locality, we brought them to the center, and we gave them orientation on how to handle it and how to use and how to record the user feedback. But due to their literacy level, they need to have a regular follow-up and regular interaction with them. But as Magdas mentioned before, there is no technology-related issues in that area. There is no electricity. A number of people using mobile phones are very few, and whenever we want to reach them, we have to contact the Kabale officials or some officials who move with the community in that pastoralist group. So we were challenged to give them a regular feedback. And in the first time, we tried to make a review meeting at the central part, and we tried to move to their location. And due to the communication gap, I mean, there is absence of communication matters. We are not able to collect them and give them feedback. But that from our analysis, we got that the ones who came for the review meeting and attended the review meeting and got our feedback were able to perform good at the end of the Amplio Talking Book implementation. And when we gathered the overall data, we saw that the ones we contacted for the review meeting has at least performed and tried to cover the audio sessions successfully. That was what we observed, and that's what I want to add on Magdas. Thank you.
That's great. Thank you, Avinet, for that. Before we turn it over, actually, I think I will turn it over to audience questions at this point. And I see one in the chat. Erin, have you gotten others at this point?
This is the first question, B.
Okay, great. So this question is from Henry, and he asks, are users confident to give feedback, especially if it is a negative feedback, when they know that they're being recorded? Some may feel prohibited by fear of reprisal, and how is this handled? And I can answer a little bit of the first part, and then I can let Avinet and Magdas talk about the personal experience. The way the Talking Book collects the user feedback, you can set it up so that one user cannot hear what another user has to say. They can't listen to the recording. So that's one way that you can provide some confidentiality. The device itself also does not necessarily identify who the speaker is. You might know what village the comment was coming from, or what community based on your rotation schedule, but you wouldn't be able to say specifically who the speaker was unless you were able to listen and recognize their voice. So those are some internal tools that help with those issues. But I would be curious to hear from Magdas and Avinet whether or not how free people felt to record things. And that kind of dovetails off of my question, which was, did you hear anything that surprised you in those recordings? So I'll let you, I'm not sure who, Avinet, would you be the right person to start to field that question?
All right, for the user feedback recording, actually the ones we try to collect is not as such sensitive, and it's not related to the authorities or other organization or other government issues. It's mostly on sexual reproductive health and adolescent girls' well-being and the like. And whenever they ask, you try to mention it, the recording is anonymous. No one knows the name except the groups in the group members. And we don't know who responded to who gave us the feedback on our side. We only listen to the feedback, and in some cases it might be sensitive depending on the situation or on the project objective. For us, it is not as such sensitive. And we talk about adolescent, and adolescent issues are not as such sensitive issues unless it is about early marriage counseling and like that. And as I told you, what we got from the user feedback in Amplio, it differs from the curriculum based. Whenever, as Magdas mentioned last time, from our M&E expectation, in the paper-based curriculum, we expect them to report if there is an early marriage or sexual reproductive sexual violence to their mentors or to our facilitators. The community facilitators are our staffs. But in this case, they are not expected to fill this one, because whenever they speak on the record on the user feedbacks, we collect it in the quarterly level, and we are not able to respond to the situation because the situation like early marriage and sexual reproductive sexual violence is urgent and it needs urgent mitigation. But here, what we want to know is more about the qualitative number of attendance, who attended it, and if they have any feedback on the content. Mostly we focused on the content, so it is on the content, and there is no sensitive issues. And
Great.
okay.
And Eva asks whether or
Okay.
not Eva asks whether or not the feedback is happening in groups or in private or some combination.
Okay.
Just to answer all these questions, they can take the feedback privately based on the sensitivity of the feedback during the group meeting or privately. The Amplio devices are flexible to capture feedback privately or during the as a group or during the group meeting. The other things I want to explain is if you want to know the feedback giver, we can the Amplio feedback function also able. My name is Magnus. I want to say this like so the device records this kind of things. Thank you.
Great. So if they wanted to identify themselves, they could. And then we had one final question about whether or not about your actual impact, and are you seeing differences between the boys groups and the girls groups, and have you seen any shifts in the social norms yet within the community or the stakeholders based on this engagement?
As Abner said earlier, we have a research partner, Gage. They are doing research every year, the process as well as the impact. So we will get the results from the Gage finding for the impacts of the Amplio device in that community. I expect results from our research partners because they are following courses of adolescent in each implementation area. We will get the results from the Gage partners. From the program side, we can capture, there are different feedbacks given by the adolescents. They are wishing to continue these sessions in that area. They want us to share or disseminate the message for their friends, parents, or the community, etc. This gives clue for us there is difference for by addressing the adolescent using the talking book devices. Thank you.
Great, thank you. We are coming to the end of our time together, and I want to thank our panelists for joining us and sharing their experience with using the talking book as a device to enable participatory community engagement and participatory monitoring and evaluation. And we will be sending around, here's our contact information. And we will be sending around a recording of the webinar. And we also have, as part of the slide deck, a list of resources around participatory monitoring and evaluation. If you are newer to the concept, the first two links on the slide are really good overview articles that give you the history of the discipline and how it's grown since over the years. And then there are also a number of toolkits that you can use to develop participatory engagements for your monitoring and evaluation activities. And let's see, well, there are several notes in the chat. There is also a link about where UNICEF Ghana has been also looking at user feedback and in the work that they are doing. So we will send those references to you as well. And I think that brings us to 8 o'clock. So again, thank you everyone, both to our panel and to our attendees. We would love to hear from you, and we would love to explore with you whether and how you might use talking books in the work that you are doing in your communities and with your organizations. So everyone have a wonderful day or evening, depending on your time zone. And thank you very much.